Hello, I want to talk about chin problems and solutions today. So when we call the chin problem, as you know, it's generally used for situations where chin is not sufficiently obvious and located backward. And I will talk it about here. But there are cases when chin is long, which is also called witch's chin. I will not talk about them now. Chin contributes a lot from the profile to the face symmetry of the person. The importance of the chin is great in the transition from the upper 1/3 to the lower 1/3 of the face. At the same time, enhancing the chin forward will reduce the appearance of the double chin to some extent. At the same time, chin also plays a key role in frontal view when the face lines are wanted to be more prominent. Making the chin prominent can only be done by adding volume. We can achieve this volumizing process by injecting a substance or placing an implant over the chin. Starting with the simplest and the fastest application, I will talk a little bit about the methods. The fastest method to be applied in office is chin filler application. Hyaluronic acid fillers can be used to extend chin forward and make it more defined. The only disadvantage of this procedure is that the result is temporary. We know that hyaluronic acid filler stays in the area where they are applied for a certain period of time. In chin, this period is on average 10 to 12 months. Another form of injection that can be done in the office is to inject your own fat tissue to the chin. Although it can be done under local anesthesia, it's a little bit more complicated. First of all, it's necessary to take the fat tissue from the region you will determine with your doctor, and the harvested fat grafts are processed in some way to enrich it and then inject to the chin. Since it is your own tissue, there is no risk of allergy. Its permanence is definitely better than hyaluronic acid fillers, but a certain amount of fat tissue loss occurs in the first 1 week in fat injection applications. Therefore, it may be necessary to perform overcorrection to have better result. Placing chin implant, which is another permanent method, is an operation. I perform this method at the office in my practice. An implant can be placed in the desired place through a 2 cm incision under the chin. Although implants can be found in different materials, I always prefer silicone implants. The procedure takes 30 minutes in total. You have stitches which are resolvable under the chin. After about 6 to 9 months, the scar becomes almost invisible, but it has already hidden. The most complicated procedure, also known as mentoplasty, is the structural changing of the chin bone, which is an operation performed under general anesthesia. Operation is performed through an incision placed inside of the mouth after the planning on the x-rays taken before. I apply this method to the chin, which I do not believe can be corrected by the other procedures that I mentioned. If you have any questions to be answered about this process, you see how you can reach us right next to me in the screen. Have a nice day.